What is importance of growth scan and Doppler during pregnancy? Hello everyone, I am Dr. Ajitey Tamhane, consultant radiologist and fetal medicine expert. Growth scan is usually done when the pregnancy reaches third trimester, that is usually after 28 weeks of pregnancy. In growth scan, we mainly monitor the growth of the baby, that is whether the growth is properly going according to the gestational age and if there are any differences in the growth, that is usually that we call IUGR, because if the growth is lacking, then we have to take some measures to enhance the growth of the baby, or then we have to take some decisions accordingly to deliver the baby early, or accordingly we have to treat the patient. Then we see for the placenta. The placenta, usually sometimes what happens that there is early calcification within the placenta, and that is indication of intrauterine infection. So if there is early calcification, then we have to see whether the blood flow is going properly to the baby and whether the growth of the baby is in proper state. Then we see for the water level, means the water around the baby is assessed during the growth scan, because if the water is less or more, then accordingly we have to do further investigations. Like if the water is more, then there may be gestational diabetes, means diabetes to the mother, which is causing increase in the water around the baby. Or if the water is less, then it may indicate that the blood flow is not proper to the baby, and so the water is becoming less. Then accordingly we have to treat the condition. Then we assess the cervical length, means the cervical length is assessed whether it is reduced, or if it is if in premature deliveries the external os opens, and so we have to monitor that. Then we see for the position of the baby, whether the head is down or the baby's legs are down, because accordingly we have to plan the mode of delivery, that is whether normal delivery or cesarean section. Then we see for the blood flow, that is the Doppler, means blood flow to the baby is assessed in this growth scan, which is called Doppler study, because if the blood flow is altered, then it may affect the growth of the baby. So we have to take some measures to increase the blood flow, that is we usually give arginatric sachet, means that is a powder which is given to we mix in the water, and this is given to the patient to increase the level of water around the baby and also to improve the growth of the baby. And also we can see for 3D imaging of the baby, because if the water level is good around the baby, then we can take 3D images also during this scan. Thank you.